This is Dr. Sudarshan Ray, bringing to you the latest in the series of the psycho-educative videos, which are meant for the common persons to raise awareness on mental health problems and to help decrease the stigma associated with such mental health problems, which is still prevalent in this part of the globe. Today we are going to talk about fairly common method of treatment of mental health problems, which is known as the transcranial direct current stimulation. The transcranial direct current stimulation. Okay. Now, this is commonly referred to as the electric shock, but it's nothing to worry about. I mean, it's not the electric shock which we get when we actually face a short circuit in the household. Nothing of that sort. Okay. So this transcranial direct current stimulation is usually given through a handheld battery operated device and gives the sensations of pins and needles. A handheld battery operated device, and the sensation is usually of pins and needles. Okay. Now, what is actually this transcranial direct current stimulation? The transcranial direct current stimulation is a non-invasive neuromodulatory technique. It's a non-invasive, there's no penetration, physical penetration, and it's a neuromodulatory technique. Okay. The currents used are generally in the range of 0.5 to 2 milliamperes, and the current is delivered to the scalp through electrodes. There's an anode and there's a cathode, and these electric currents are used to moderate activities of different regions of the brain. Different regions of the brain are concerned with the different the mental health problems which we face, and so this is how it is used. Now, historically, the torpedo fish which generates current was used for a pretty long time, not by therapists actually, but people did find out that the current stimulation provided by the torpedo fish, they actually alleviated certain mental health problems. Now, in case of transcranial direct current stimulation, the anode is the excitatory provides the excitatory stimulus, and the cathode provides the inhibitory stimulus. The immediate effects are, it suppresses or it excites the resting membrane potential. This transcranial direct current stimulation excites or it suppresses only the resting membrane potential. It does not affect the action potential, unlike the magnetic stimulation. Okay, so no action potential is affected. The intermediate effect of this transcranial direct current stimulation is that it modifies the synaptic microenvironment. It modifies the synaptic microenvironment, the NMDA and GABAergic activities, the NMDA and GABAergic activity. Then we come to the delayed effect. The delayed effect is this tDCS induce the neurotransmitter changes in the synapse. They induce the neurotransmitter changes in the synapse. The changes take place at the synaptic level, and the late effects of tDCS, the transcranial direct current stimulation, is the neuroplasticity, which I talked about in earlier videos, through modulation of the long-term potentiation and the long-term depression. Okay, and this alters the intercellular cyclic AMP, calcium, and synaptic protein channels. This acts by altering the intercellular cyclic AMP, calcium, and the synaptic protein channels. Okay. Now, talking about the long-term effect of this tDCS. I mean, the greater is the duration of the stimulation, the greater is the time actually taken by the brain to return to baseline activity. Okay, to return to baseline activity. So obviously duration, if the duration of the transcranial direct current stimulation is more, the time taken by the brain to return to baseline is more. Obvious reasons, and obviously the duration, the strength of the current, and the sessions, the gap between the sessions or the number of sessions in a week, they do play a very vital role. Now, the parameters which are essential for this transcranial direct current stimulation. One is the size of the electrodes, the position of the electrodes are an important factor. The intensity of stimulation is another factor. The duration of the stimulation, as I said, is a factor too. The number of sessions per day and the gap between the sessions, another factor. The different physiological and adverse effects profile, they are they are varied. I mean, through this transcranial direct current stimulation. Okay. One thing is that the tDCS devices are not standardized worldwide, so there are certain guidelines which we use, which perhaps basically can be utilized, more or less utilized by the different tDCS devices which are available worldwide, and which I have mentioned are not standardized. Okay. Now, the duration of this tDCS, one session is usually 5 to 10 minutes. The intensity is generally 0.5 milliampere to 2 milliampere. The size of the electrodes standardized. I'm talking about the devices. The electrodes are 20 centimeters square to 35 centimeters square. The current density is 24 microcentimeters square to 29 microcentimeters square. The site of stimulation is the dorsolateral prefrontal cortex, the motor cortex, the visual cortex, somatosensory cortices. I mean, depending on the mental health problem we are treating. Now, there are certain terms. I mean, what we do, the procedures is the ramp up, in which the stimulation is gradually increased over 30 seconds. In ramp up, the stimulation of the current is gradually increased over 30 seconds, and in ramp down, the stimulation similarly is decreased over 30 seconds. The ramp down, the stimulation is gradually decreased over 30 seconds. What are the uses of this transcranial direct current stimulation in neurology? In neurology, it is used mostly for the post-stroke rehabilitation. It is used in Parkinsonism. It is used in tinnitus. It is used in fibromyalgia. It is used in enhancing the cognitive performance and learning. And of course, it is also used in case of migraine. In psychiatry, the uses are in depression, especially depression, which basically lead to suicidal behavior, self-harming behavior in the individual. In case of schizophrenia also we use it. In case of substance use and craving, tDCS is also used management of this craving and substance use disorder. In case of obsessive compulsive disorder, OCD, we use. In case of mild cognitive impairment also, we do use this transcranial direct current stimulation. Now, in case of tDCS, before administering tDCS, there are a lot of protocols to be followed, and in case of tDCS, basically the laws vary from state to state and from country to country. There should be an appropriate indication. There should be an appropriate indication for tDCS. First, the patient has to be explicitly, the patient and the patient party have to be explicitly informed, okay, and the demo video of the tDCS procedure, the transcranial direct current stimulation procedure, the demo video has to be exhibited in front of the patient and the patient party, and obviously the written consent is required. It's only after these protocols have been followed which are compulsory. Then we can actually prepare the electrode. The gel is used over the scalp, aiding conduction. Electrodes are bathed with saline water so as to decrease the resistance and increase the conduction. Now, in case of tDCS in schizophrenia, what is the use of tDCS in schizophrenia? In case of schizophrenia, basically, it is useful in the treatment of these auditory hallucinations, which is so much common in schizophrenia, hearing voices of people who are non-existent. So in order to treat that, this tDCS has been found to be useful. Okay, now this, but of course, the tDCS is only used in case of auditory hallucinations which are resistant to this antipsychotic treatment. Only when it is resistant to antipsychotic treatment do we use tDCS. The sessions are twice daily for 5 days and the duration is 20 minutes. It does improve the insight, which is so very vital in case of schizophrenia. The insight can use antipsychotics to improve the insight, or you can use the transcranial direct current stimulation in case the antipsychotics do not work. So it improves it has been shown to improve the insight in such cases. Okay. Now in case of depression, tDCS depression. Now it has been seen that once again when medication cases are it has been seen that tDCS has persistently reduced the scores on the depression scale, and the duration is once daily session for 10 days and the duration is 30 minutes. Okay. Now, tDCS is also used in obsessive compulsive disorder. Obsessive compulsive disorder is a very common disorder. I mean, I say that all of us, more or less all of us have sort of OCD, in our daily lives, and which gives rise to perfectionism and the sense of orderliness which we want in the lives of work. Okay. Now, in case of OCD, there is a criteria, there is a benchmark marker which is known as the response inhibition. Response inhibition is a prognostic indicator for obsessive compulsive disorder, and it has been seen that transcranial direct current stimulation does actually this improves this response inhibition in case of OCD, which is actually a prognostic marker. So the improvement of OCD does occur in case of when we use tDCS. Okay, so symptom severity is decreased. The occurrence is twice daily session for 5 days, and the gap between the sessions will be a minimum of 3 hours, and the current will be 2 milliampere, and the duration of each session will be 20 minutes. What about tDCS in the mild cognitive impairment? Another mental problem in which we use the tDCS. Over here also the improvement has been seen in mild cognitive impairment. The current is 2 milliampere, the duration is of 20 minutes, and the total therapy duration is of 5 days. tDCS is also used in substance use disorder. In case, as we say, that in substance use disorder, the intertegmental area and the reward part of the intertegmental area, the nucleus accumbens, the hippocampus, and the prefrontal cortex. As we say that this is the reward pathway, and this reward pathway is actually stimulated by this tDCS. tDCS actually accesses the serotonin pathways, which is responsible for mood, memory, sleep, and cognition. Serotonin pathways are accessed. Okay. Now, in case of this substance disorder, basically serotonin, this tDCS, it gets access to the dopamine-containing neurons which are deeply seated. The dopamine-containing neurons are deeply seated within the brain. So, I mean, the access has to be indirect. The access of the tDCS, the current pulse, has to be indirect, and naturally, what happens is that the dorsolateral prefrontal cortex, the DLPFC, okay, the dorsolateral prefrontal cortex, these neurons, they project to the ventral tegmental area. So the dorsolateral prefrontal cortex projects to the ventral tegmental area, and as we all know, that the ventral tegmental area, is the starting point of the reward pathway, the reward mechanism in our brain. The ventral tegmental area, the nucleus accumbens. Okay, so this way actually we access the pathway, and the PTA, ventral tegmental area, the nucleus accumbens, the hippocampus, and then prefrontal cortex. So I mean, since the dorsolateral prefrontal cortex, as I've already mentioned, neurons, they project, neurons, they project onto the ventral tegmental area. So basically, we are accessing this reward pathway through the ventral tegmental area. So that's an indirect access. Dopamine neurons are actually deep-seated within the brain. Now, the activation of the dorsolateral prefrontal cortex, it reinforces the drug-avoiding behavior. It reinforces the drug-avoiding behavior, the activation of the dorsolateral prefrontal cortex, into which the ventral tegmental area dopaminergic neurons project onto. Okay. Now, so tDCS does disrupt the drug craving behavior. tDCS does disrupt the drug craving behavior, and the dorsolateral prefrontal cortex stimulation might mimic the craving related process. The stimulation might mimic the craving related process, and thus reduce the necessity for reward-related craving. So I mean, this stimulation of the real PFC through the PTA, the dorsolateral prefrontal cortex, I'm repeating, and the ventral tegmental area. I mean, access through the ventral tegmental area. Okay, neurons project, as I mentioned, and once I'm repeating, so you can recollect. And so the stimulation, as I said, mimics the craving-related processes, and since the craving-related process is mimicked, so the necessity for the reward-related behavior is reduced. So that is how broadly the transcranial direct current stimulation works in case of substance use disorder. The current mostly used over here is 2 milliampere, and it is once daily for 5 days, and the duration is of 20 minutes. So this is a very brief overview of transcranial direct current stimulation delivered through a handheld battery operated device, and some of the disorders, mental disorders, try to explain in the layman's terms how they can be benefited, and the various protocols and other small technical overviews are try to present in this video of mine. If you like this video, do put your likes, your comments, and subscribe to my YouTube channel, and share this video so that people become more aware, and basically the stigma associated mental disorder is decreased to a significant extent. So till the next video on the psycho-educative videos from me coming, it's goodbye from my end.